President Cyril Ramaphosa, Honorable Premier of the Limpopo government, I come from Limpopo. My apologies, Premier. I come from Limpopo. The Premier comes from Bushbuck Ridge. And we gave Bushbuck Ridge from Limpopo to Mpumalanga, so don't blame me that much. We gave it to you recently, that area. Anyway, Premier, once more, apologies. Let me also recognize the chairperson of the Provincial House of Traditional Leaders and Quezon Leaders, Khosi Lamekunkwena, the Executive Mayor, and the executive mayor of the district and the local mayor. Let me stop there and say I stand on the protocol already established. Mr. President, we are excited today to be here and be witnesses to the new emerging trend of providing state-of-the-art facilities for our communities. For indeed, this is state-of-the-art. Those of you who believe they've got a lot of money and can only get their treatment in private hospitals because you are not overcrowded in the wards, just come and try here and see if there's any difference. But the truth of the matter, President, is that in our country, our communities are growing faster than our facilities. The populations in South Africa are growing faster than our facilities. So we wish to pull up our socks to make sure that our facilities catch up with the population growth. It is for this reason that we are starting to open new hospitals. Today you are here, Mr. President, opening King Nyabela Hospital. Very soon we'll be calling you to open Silom Hospital in the Vembe district of Limpopo. And very soon also we'll be calling you to open Mpumalanga Hospital right here in Mpumalanga. Those hospitals are going to be completed, and very soon, within a few years, maybe 3, will be open. You will be opening the state-of-the-art Limpopo Academic Hospital. We are also evidence, Mr. President. Those I've mentioned are the ones under construction. But Mr. President, as we know, you know, through your help, we submitted a list of 11 hospitals to Treasury, for which Treasury has already established a unit to start working on building those 11 hospitals, because we want to keep up with our population growth. Out of those 11 hospitals, we have submitted to Treasury, Honorable Premier. There will be 2 from Mpumalanga. So this is not the end, we are just starting. It's the beginning. Mpumalanga is unfortunately the only province that does not have a mental hospital. We regret that, we don't like it, and we've submitted that to Treasury. That this is one of the hospitals that must be built. All the people who have got mental problems in Mpumalanga are all over the country looking for health care. We don't enjoy that, Mr. President, and we want that to happen. And Mpumalanga, as well as Limpopo, Northwest, and Northern Cape, do not have academic hospitals. So for this reason, the list that was submitted to Treasury includes an academic hospital for Mpumalanga, because we do not have. Now, spoke for me. I thought that speech was written by me, actually. The speech that Hoshi has made here, I said, oh my God, it sounds like the speech I've written. Because he spoke about NHI, which is being rubbished, and he said they are calling experts to rubbish it. Hoshi, the people you see in the media who are called experts in healthcare, and they are given the title of expert. Let me tell you how you get that title in the media, the title of expert. You get it if you oppose the government. If you oppose the government, you get the title expert. The experts in health are those who oppose NHI or universal health coverage. The real experts around the world who drew up the program, because it's not our program, it was even accepted by the United Nations. The real experts who drew that program gave it to the World Health Organization and the United Nations that the world needs this. You'll never see them on the media because they are going to explain how good the program is. The former Director General of the World Health Organization, Dr. Margaret Chan, who was the Director General of Health in Hong Kong, summarized it. He said NHI is an equalizer between the rich and the poor. Simple. If you don't understand it, it equalizes poor people with rich people. And that's why those who believe they are rich will oppose it, because they don't want to be equalized with the poor. They don't want the madam to lie in the same ward as their domestic worker, which is exactly what we want to achieve with NHI. And we are going to go on to achieve it. We are going to go on to achieve it, Mr. President. The last thing I want to say, very last, and I think I need to say this. May I ask the CEO of the hospital to stand up? May I ask the clinical manager of the hospitals to stand up? May I ask the nursing manager to stand up? Oh, I didn't see you. Nursing manager, the boss of nurses. Yeah, no, stand up. I didn't say you must sit down. Yes. Yeah, now I want to talk to you. As we live here, we've done our job. We've put up a facility for you. And we are coming here to celebrate it. With the president observing, as we live here, the ball is in your court. The ball is in your court because quite often, when the health ombudsman gives reports about hospital, they complain about management. They complain about maintenance of the facility. They complain about cleanliness. Those things don't rest in the hands of the president or the premier or me or the MEC. We are going back to our offices. They rest in you. Can you imagine a few months later when we come back here and find the hospital dilapidated and find the hospital not clean and hear the patients complaining about the attitude of staff? I'm seeing... I am quite sure staff members of the hospital, I'm quite sure that will get the message. It's not from me. The message is not from me. I'm sure you are getting it from the people. I don't know yet what it means, but they gave you a message with their reaction. And that message is not from the president, it's not from me, it's not from the premier, it's not from the MEC. The message is from the people who are saying we need to up our game. so that when they visit this facility, they will be very happy. I'm not just talking, Mr. President. I was very disappointed, I must tell you. Very disappointed about a hospital I opened in Abington some years back. State of the art, everything looking like this one. But when I visited a few years later, my heart was bleeding. It was not taken care of. It was not managed in the way a hospital have to be managed. So I'm informing you, in the presence of the President, in the presence of the masses, that any day we visit this hospital, any day we visit, I want to see myself in the floor. In other words, the floor must be like a mirror. It must shine. I want to look down on the floor and see my image there. I want to get into the whole, all the halls, and I find them shining. I want to get into the walls and found the patient smiling, not complaining, not dragging me, yes, not dragging me by the jacket and telling me I've been waiting here for too long. That is what we want to see in this hospital, and that is the message I'm leaving to you. And I can tell you, you'll be able to do that. It just depends on your will. It depends on your will and your liking, nothing else. It doesn't need a lot of money, it just needs your will and your heart. And as I look at you, I believe you have got the heart to do that. I will take this opportunity to call the Commander-in-Chief now. Yeah, the real Commander-in-Chief, not the toy one. The President of the Republic of South. You may sit down. If the President wants you to stand up, he's going to do so also. But for now, you may sit down. I'm talking to you. I suspect he might like to speak to you too. The President of the country, the Commander-in-Chief, who was very happy when he was going through all these wars. He was very happy. He was very proud. And I want him to be proud even 5 years later. If he happened to visit this hospital, he must be as happy as he is today. Commander-in-Chief, Mr. President, can you all stand up to welcome him? Please, all of you, stand up to welcome the Commander-in-Chief.
Amandla. Amandla. Sanbonan. Dumelang. Abshin. Masiari. Molweni. Lochani. Program Director, MEC Manzini, Minister of Health, Dr. Aaron Mutwaledi, the Premier of our province here in Mpumalanga, the Executive Mayor of our local municipality, the Executive Mayor of our district municipality, the Chairperson of the Provincial House of Traditional and Khoisan Leaders, Kgoshi Mokoena, nabanye ondabezitha abakhona lapha phakathi kwethu, the community leaders and religious leaders who are here present, the staff of this hospital, this most beautiful hospital, the doctors, the nurses, the technicians, the management executive members of this hospital, the officials in the health department here in Mpumalanga, and the officials of the health department at national level, citizens of Middelburg, and Mpumalanga, I greet you all in the name of our government. Ngiyathokoza kakhulu kuba lapha phakathi kwenu. And I'm particularly pleased that we are here to celebrate this important milestone in our quest to ensure that there is quality healthcare services for the people of Mpumalanga. Today we are officially opening the King Nyabela Hospital, which will serve more than 240,000 people in the Steve Tshwete local municipality. Siyabonga kakhulu, and let's all give a big round of applause for the opening of this hospital. For more than 100 years, the old Middelburg Hospital was the only hospital that was serving the needs of our people here. And over the years, it became dilapidated, too old, and too expensive to maintain. So the decision was made by this government to build a new hospital to serve our people here. This hospital was ready for occupation on the 1st of November 2025, and today it is officially opened. And we must also thank the construction team from the Enza Construction Company. A number of them are here, including the CEO. They've done a fantastic job. They delivered the hospital on time, on cost, without too many overruns. And let's give them a round of applause for that. All the services that were provided at the Middelburg Hospital have now been relocated here, but the quality of care and range of services this hospital provides are a huge improvement on the old. As I came in, they were giving me a full explanation, and they showed me the full suite of services that are here. Services that you find in private hospitals, services that you find in regional hospitals, in national hospitals. They are here. They have sophisticated modern equipment for X-ray and for everything else. When babies are born and there are challenges, they have incubation. When people get injured, they have the procedures and processes to look after people. They have dentists. The pharmacy where you get your medicine is quite modern, and it is quite impressive. Now, the scale of this facility is really impressive. This is a 220-bed hospital with surgical, medical, pediatric, antenatal, postnatal, neonatal, and high care wards. It has a world-class accident and emergency department, and it also has 3 operating theaters. 3 operating theaters, which is fantastic. The outpatient services are just as impressive. Beyond regular outpatient services like the pharmacy, the TB and HIV management, dentistry and eye care, patients will be able to access those people who deal with food, dietitians, and nutrition services, social workers, occupational therapists, physiotherapists, medical male circumcision, mental health, and dozens of other services. So this is a full and complete hospital, and we are truly grateful to hand this hospital over to the people of Middelburg. Nasi isibhedlele esihle. Now, this, I want to stress also what Minister Motsoaledi was saying in a minute. This hospital is what we mean by comprehensive healthcare service. Healthcare is not just about calling for an ambulance. It's not just for calling an ambulance when people are sick. It is not about fetching amapilisi every month at the clinic or going to the emergency ward if there has been an accident. Comprehensive health care is about walking alongside our people through every season of their lives. It is about supporting a mother with antenatal care as she prepares to bring new life into the world and ensuring that she delivers safely and that both mother and baby get the support they need. Just as we were going past the place where babies are delivered, the nurses were telling us that we have just delivered a baby through operation, and the baby is healthy and the mother is healthy. That very minute. And this is what healthcare is about. It is about helping people to keep and stay healthy and starting to do so when they are still children. Comprehensive health care is about providing the necessary care to our elderly when they are still in good health and supporting them when they become frail. It is about reducing the burden of diseases across society. This means tackling communicable diseases like tuberculosis, TB, and HIV. But it also means tackling non-communicable diseases, the so-called silent killers, such as diabetes, high blood pressure, and heart diseases. These are among the top 10 diseases here in Steve Tshwete local municipality. Now, these diseases are claiming lives, they are straining our public health facilities, and they are also weakening the productivity of our country. Comprehensive health care is about healing the mind as well as the body. Stress and mental health issues are affecting lives and communities. People struggling with mental health issues often feel alone. Many turn to alcohol and substance abuse so that they can cope with life, with the stresses of life. The healthcare sector is also carrying a huge burden as a result of high levels of violence in our society, including the terrible scourge of gender-based violence. Comprehensive health care is about prevention, early detection, and management of all health issues our people face. Now, as the World Health Organization, the WHO, reminds us, health is not merely the absence of illness, but complete physical, mental, and social well-being. Healthcare is about giving every man, every woman, every child the chance to live with dignity. This is the promise of our Constitution, which declares that everyone has the right to access healthcare services and that the state must take responsible measures within available resources to achieve the realization of this right that everyone must have health care. Now, the opening of this district hospital shows and demonstrates our commitment as a government to give effect to this constitutional right. A healthy nation is a nation where children learn better, where adults are able to work and provide for their families. When a nation's people are healthy, its economy becomes healthy, and all of society then prospers. By contrast, weak healthcare systems lead to higher levels of mortality, especially in communities with limited access to clean water and sanitation, poor housing, and high unemployment. What often happens is that people present themselves too late at health facilities when some of those diseases are too advanced to treat. And that is why prevention, that is why detection and monitoring is so critical. That is why hospitals with the capacity to provide comprehensive services are a priority that we are taking so seriously. This new health facility is named King Nyabela Hospital, the son of King Maboko, one of the most fearless warriors and the unifier of the Nzunza and Ndebele people. King Nyabela was renowned for fiercely defending ancestral lands. He was renowned for defending our people and our land against European encroachment, for being relentless in seeking peace. The Nzunza and Ndebele have a history of resistance and solidarity. We recall the Mapoch War of 1882 and to 1883, when King Nyabela honored the Pedi King, King Mampuru II, from the Boers. We recall that it was in Middelburg where King Dinizulu Kacechwayo Kampande was exiled in 1910, and where he spent the last years of his life. We also recall how in the 1960s, the then Prince Goodwill Zwelithini, the past king of the Zulus, was given shelter by the Skosana family here in Mpumalanga, amid fears for his safety following the death of his father. Now, this speaks to the spirit of a people who throughout history have been peacemakers and resolute and brave when called upon to do so. So today, Bagiti, we honor King Nyabela, and we honor all the forebears of the Nzunza and Ndebele people. Let this hospital be a living tribute to their resolve, to their principle, and to their commitment. In taking forward their legacies, I call on the community here to take care of this facility. It is significant that the community has been actively involved in this project, with well over 1,100 work opportunities that were created, including more than 520 work opportunities for the women of this place. Now, there were challenges during the early construction stages with the so-called business forums, the construction mafia, who disrupted the work. There were also legal challenges with contractors. We must be clear that acts of intimidation and violence relating to the construction of public infrastructure will not be tolerated. We will not tolerate those. And we are taking steps to root out the construction mafia because we will not tolerate them. We cannot stand for the construction of hospitals, of clinics, of roads, of dams, or any public infrastructure being stopped and being disrupted to advance some individuals' financial interests. Ngoba bona bafuna imali, abafuni ukuthi kube nentuthuko esizweni. And we are going to stop that. We are going to root them out. Ngeke sibavumele. And we will continue to improve access to quality services by refurbishing facilities, by building new hospitals, as Dr. Mutsoaledi said, and by expanding primary health care platforms. And as you heard, Mpumalanga needs a psychiatric hospital, and we are going to build a psychiatric hospital here in Mpumalanga. And we will continue to promote access to healthcare information in languages that our people understand, and through platforms such as radio and television. We are working to put in place the critical building blocks of the National Health Insurance, or NHI. At its heart, the NHI is about fulfilling the constitutional right of access to health care, without this being dependent on where one lives and on one's ability to pay. The NHI ensures that all people can and must have access to the full range of quality health services that they need, where and when they need them, without experiencing financial hardships. So for the NHI to be a success, we need a healthcare sector that is properly governed and well-led. We need a skilled workforce. We need high standards of service. We need high standards of delivery and uninterrupted access to the medicines that people need. Now, to build a healthcare system that meets the needs of our people requires the involvement, the resources, and the capabilities of all sectors of society. And today, here, we see what national health insurance is all about. NHI, iyabonakala la. Those who are opposed to NHI, open your eyes. And NHI will happen whether you like it or not. It is going to happen. Now, as we open the King Nyabela Hospital, we are determined that all hospitals that have been commissioned must be completed to budget and on time. There can be no space for corruption, for fraud or waste in the procurement of health infrastructure or supply or services. We've done much to tackle corruption in health. Stolen funds are being recovered. Alleged perpetrators are being hunted down and prosecuted. But we do need to do more. We will end the criminal actions of those who steal from the sick and vulnerable, who endanger people's lives. To those entrusted with the health of our people, we are counting on you to treat our people with respect and dignity. With respect and dignity. We say to our health officials, please treat our people with recognition, with respect and dignity. That's what we want to see here. Please do not insult our people as they stand in queues. Don't make them sit for too long on the benches waiting to be treated. Don't make them wait too long for hours for the medicines that they deserve. Sithi abantu bakithi mabahlonitshwe baphathwe kahle by those who provide healthcare services. While hospitals and clinics are built with bricks and mortar, the heartbeat of our facilities is provided by healthcare providers who diligently perform their duties, sometimes under difficult circumstances. And I want to salute the healthcare professionals that I have seen here in this facility, and those that I meet across this country. Those that I saw here, I saw that they are real professionals. They know their work. I asked them a number of questions and they could answer. And I could see that they are truly, truly dedicated to do the work to serve the community. So I say to those healthcare officials that I saw, from the CEO right through to the nurses, to the porters, to the cleaners, thank you, thank you, thank you for what I saw today. And to the community, we say we are a nation that practices Ubuntu. We are a nation of compassion, nokuzwelana. Just as none of us would wish to be turned away from a hospital when we need medical attention, we should not turn other people away from the treatment that they need. And even as the workers of this hospital may have any dispute with the management, I do not want to hear that when they either go on strike or have a dispute, they are going to prevent patients from being properly treated. So this hospital must be a hospital that treats people with care, with dignity, and with respect. And with those words, I now declare that the King Nyabela Hospital is now officially opened. Siyabonga kakhulu. Thank you very much. Siyabonga.